A patient with clinical hypothyroidism came to the clinic for a routine follow-up. He has been initiated on levothyroxine therapy for 6 months. The clinician suspects that the patient has poor adherence to therapy. Which of the following lab results will be consistent with the clinician's suspicion? Okay, so patient is hypothyroid, is on levothyroxine therapy for 6 months. What is the clinician's suspicion? He is thinking that patient may not be taking the medication. Okay, so the question is very simple, right? How would you assess the response once you start them on the hormone replacement? So once you start giving the external hormone, right? Can we check the hormone level directly? No, because it is dependent on your dosing, right? So you have to, like, see, we know how is the thyroid gland regulated, right? You have the hypothalamus, which produces a hormone called as TRH. TRH stimulates the pituitary gland to produce a hormone called as TSH. TSH stimulates, right? So TRH is stimulating the TSH production, right? The TSH is stimulating the T3 and T4 production from the thyroid gland. Okay, and in hypothyroidism, this T3 and T4 production was low, so we started replacing it. And once we start replacing it, right, we cannot use T3, T4 levels for assessing the response, right? We should look at TSH levels. So if T3, T4 is adequate, right, then the TSH will be in the normal range. So if the T3, T4 is lesser than the requirement, right, in that case, TSH will still remain elevated. And if the T3, T4 is more than the requirement, like our replacement dose is high, then the TSH will be suppressed, right? As simple as that. So obviously the answer should be TSH here, right? I will be assessing whether patient is taking medication properly or not, and whether the dosing is adequate or not by looking at the TSH. Certainly not the T4, certainly not the T3. Okay. Now, if the patient's dosing is inadequate or if the patient is not taking properly, right, in both those cases, I will expect the elevated TSH, making option D the correct answer for this question. And that's it for me here, guys. Thank you.